Metaphorically, as a species, we have to stand up.
Oh, okay.
But you're standing right now.
Yeah, I'm standing. Yeah, for 10 years.
This is Lewis
I've been
Rowe.
standing up, yeah. Hey everybody, my name is Lewis. I'm a long-term activist and entrepreneur into the world of human rights and trying to help people through community health networks and resources. And presenting the neural rights advocacy is one of our best motives today because it does represent a lot of different efficacies that outlast a lot of different vineyards. So if we're talking about, different populations, and I hear a lot of people talk, but, people really honestly don't know about the advancements of the medical industry and how far they've come along. I heard some graphene or graphite, yeah, that's true. There's a lot of that stuff. So, but for our advocacy, our nonprofit that we work on, what I do, I'm the CEO, I'm also the community health worker also, and caseworker, so I accept clients and people that have issues such as them believing that they've been manipulated by technologies and stuff, which gives us the leverage because neural rights highlights these key values that are tied to it. So manipulations by technologies and whatnot where the brain just, they don't feel right. So, but, that's for a later talk because I'm very limited on time, I can't really speak too well. But Open Access Community Health is one of our main programs that we work with people, clients when they contact us is for community health work. I'm basically bridging community health work to neural rights advocacy and providing efficacy with that. And current legislations have to do with the state of Arizona and federal on top of that. Currently, right now, we're waiting on one federal law to pass called the Mind Act. I think Chuck Schumer is passing that currently right now. So if it passes, it's going to help us. It's going to be federally mandated. So it will stop a lot of tech companies and organizations from actually, compensating your brain and being able to read your neural identity. There was one doctor, somebody brought up something about something. But there was one doctor, his name was, not Dr. Groot. What's his name? Dr. Roberts Young. Yep, that's it. He said that we have an IP address tied to us. We can search for it on the internet somewhere. I forget where. But to continue on, you can look them up. So yeah, and what we're doing, and we try to get our clients, advocacy from getting state insurance, whatever state that they're in. I operate internationally, and I've been doing it for a long time. But mainly in Arizona, because a lot of organizations here, this is where we are right now, want us to, focus on Arizonians. Of course, I've been in Arizona for a long time. A lot of my nativeness comes from Arizona when it comes to health advocacy and neural rights. So, such as, and neural rights also presents the idea of cognitive autonomy, mental privacy. And people that might have been affected by technology, the FDA people, lots of people in government do recognize this stuff because they do have a federal law coming out, but the other sides of it is what they totally ignore. So there's no people talking about how nanotechnologies and implants and neurotechnologies and artificial intelligence can affect humans today. Nobody's talking about that. So we're basically like one of the only organizations that are alive right now actually doing this kind of work. So it's really good to have that because we get to do all these crazy great things and I get to cowboy my way through a lot of it. So our other program is Advanced Community Health Partner Program where we reach out to, it's called the ACHPP. We call for medical professionals, laboratories, community health organizations, researchers, technical technology specialists to work with us and help gather resources for this. I mean, there could be a certain amount of data centers that can pop up anywhere, which is bad for the environment, but still it's not going to change our health. I mean, it could, it is, it can.
It will.
But, yeah, thank you.
How close you are is a big deal, too.
Oh, yeah, for sure. It depends on how close you are. It's much like being in Hiroshima. We're falling off, So, yeah.
How bad did you glow? Yeah.
Yeah, and they still pull samples out of the readings from that. So to this day, including Fukushima, when the nuclear plant blew up over there and leaked into the water for years. I don't know what's going on with that. It still is? Oh, okay. So that's one of our other programs is partnering with people that want to work with us. And we do have partners, we do have people that want to work with us. You know, I work with people all the time. It's daily, weekly, I'm working with someone. And also, you know, one of the main things is the social media, social media, digital technologies that allow that to happen. That can manipulate, such as when Andy Biggs, you guys know Andy Biggs is probably supporters, but he's running for governor. I thought about it, but I still might try. I don't know, maybe a couple years. But anyway, Andy Biggs put out a legislation that's still pending. It hasn't even passed yet, but it was anti-big data. And this is why I support Andy Biggs. A lot of people say Andy Biggs don't really care, but I know that he does because I've spoken to his office a couple of different times, I've had meetings with him. And we're actually pending for a clinical study we're trying to get through because I'm going to go through his office as soon as we get our clinical study through and give them our data, or at least let them look at it, try to get some legislation. So we're doing that. We're focused on the clinical study that be able to tell and apprehend the reasons, causes for what's going on with people today. So, especially if it's AI or data gathering systems that can, collect all this information, that'll help us get an idea of where we're going with it. And that'll be through the clinical study. So, it'll be kind of crazy if we have to do that. This has been a year-long process, and we just got a contract not too long ago. So hopefully it goes through. And moving on from there, that was a clinical study. We mentioned the ACHPP, neural health efficiencies, exposure to technologies, digital interface, environmental, industrial, TACO, that's another one, is the interface with environmental, industrial exposures. Because of what's happening, like, the data centers and all that, that's an industrial exposure, basically. With EMF. So that's another collection of information that could be used for a lot of different lawsuits. People have been trying to do that for years, but it still hasn't gotten anywhere with it for some reason. But that's the FDA. They're in control of a lot of different things. So to finish up our mission and invitation, I'll just read this right quick so I wrote it down. Advocacy for human rights exists to protect individuals in a world where technology is advancing faster than public health systems can adapt. Then a lot of scholars and a lot of people in Europe mention that same thing, the impacts of technologies and health technologies and NIOP and IoT and where it's all going. They say it's rapidly advancing. I mean, it's just now coming out, and it's only been coming out for just a couple of years. But that's what they do say. That's the European Commission. So through Open Access Community Health, which is our community health organization, and ACHPP, we are building a new model of community health, and one that recognizes the realities of modern exposures and the importance of cognitive autonomy. So cognitive autonomy supports nobody's being manipulated or directly controlled by these systems that we're all interfacing with today, which isn't your cell phone. Because if you I hear claims of, I think sometimes about a certain topic and it shows up on my phone. And I talk to people that say that stuff, even when they say things that they have it's called neuromarketing. In Massachusetts, there's a pending legislation for that to cut off neuromarketing advertisements because of that. In some cases, but there's either Massachusetts or Boston, I forgot. We invite clinicians, researchers, community health workers, and organizations to learn more about our programs and consider joining our network. You can find additional information, resources, and contact pathways on our website at advocacyforhumanrights.org. Then, thank you for your time. Thank you for supporting the advancements of human rights and community health. Thank you.
Thank you.
Get personal.
Yeah.